And after we've done all of this, so we can then make an assessment of what's in front of us. So we may say that from the distant exam we've seen a certain abnormality with the conformation. From the palpation we've found an area that's swollen or an area that's hot. From the walking, the trotting, the lunging, we may see that the horse is a certain amount lame in a straight line on a particular leg, and an amount lame on the lunge, maybe worse on the hard than the soft, but each of those is different. So we can use all of those to make our baseline lameness assessment and include into it any information gained from the flexion tests. Once we've got all of that information together, that's our baseline assessment, and at this point we're going to decide where to go next. Now, if the vet thinks that they have a diagnosis, we may move straight to treatment. Alternatively, if there's an area that's obviously a problem, so if there's a particular joint that's swollen, we may move to diagnostic imaging of that joint or that area. And the imaging modality that's used will depend on the clinical signs that are shown. Alternatively, if there's not a clear point for the lameness that's causing the lameness, we may use regional anaesthesia, which is where we numb a particular part of the leg or the body and then see how the horse trots and moves after that. So for instance, if the horse is showing 2 out of 5 lameness on a particular leg, and then we numb the foot, we wait 15 minutes and we look to see how the horse is doing afterwards. And if there's no improvement in the lameness, we can say that the lameness is very unlikely to be coming from that particular part of the body. Alternatively, if the lameness is completely or mostly abolished by that nerve block, then we can be fairly confident that the pain is coming from that part of the body. So going back to the foot, if we numb the foot and the lameness goes away, then we can be confident that the lameness is coming from that foot. And obviously then we move on to different types of imaging to find out what the underlying problem is.